Today we've got a meeting of over 110 people coming together from different organisations, district councils, borough councils, commissioners, providers of physical health, mental health, community services and governors who represent what local people need. What today's about is a bit of a celebration of where we've got to in our focus on joining up care and having person-centred care that keeps people safe, independent and cares for people as close to home as possible. But whilst we're having a celebration, we know all too well that there are more things we need to do to support people to live at home as independent as possible. And what we're doing today is sitting together across different organisations and working out how we can best do that and thinking about how we can contribute to that individually and as organisations. We've had some real good examples today of different people from different organisations working together around a person's needs, and that's what it's all about. There's a real good energy in the room today and I'm confident this will help us build on the good momentum we've already got.
It's a really good opportunity for us to talk to each other as all the different organisations in Derbyshire who are all doing our very best to meet the needs of people, to understand what people need from us. And we're working very hard to do that, but it's an opportunity to talk to each other and work out how we can do that better together, how we can look at what we're duplicating, how we can look at what we could use each other for better, trust each other more in and talk to each other more so that people are telling their story once rather than numerous times to different professionals, and we're sharing that information together. Everybody is on the same wavelength, all wanting to do the best they can, all wanting to make this work. It's really useful to look at the commitment people have to it. People are committed to it. I think we know why we want to make the changes. I think we've got a very good idea of the changes we want to make, and the conversation now is about how we can actually make that happen and what needs to be done to move where we want to move to.
Well, it's been a fantastic morning, but the whole purpose of getting everybody together today was to really make sure that everybody really understood what the aims and the ambition are in relation to 21st century care, and I think we've really achieved that today. I think we've had some really honest discussion. Nobody underestimates the scale of the challenge, but I think an opportunity like this for the leaders of all of those different organisations, all working in the service of people in North Derbyshire, getting everybody together today has just been a really successful and a helpful opportunity. At the end of the day, 21st century care is all about improving the service we give to our communities, making services safer, to help prevent crisis, to preserve people's independence and hopefully to keep people in their own homes, supported, safe and well.
This morning has been amazing. I've been privileged to talk to so many different people on the table where I've been sat, from social care, from healthcare, from housing, from the ambulance service and from voluntary sector. And we've been talking about how we can work together to really make joined up care work. There's such a strong sense that this is the right thing to do. People are very engaged and very committed to making this work. So from our GP colleagues that are also on the table, through to consultants, and also from managers and from governors and from councils, everybody is very much committed to making this happen. I think we're all coming from different places and bringing our own perspectives to something, and that's a really good thing. You know, we'll get a better decision, we'll get a better outcome if we listen to others and join together to wrap our services around the people that we're here to serve. I've certainly got the impression that people would like to have something more of this, and that this shouldn't just be in isolation. We do have a lot of other opportunities for people to come together, public meetings, and our people, all the professionals and clinicians are already coming together regularly. But what I got a sense of today was that they would really value, the people that are working at a senior leadership level would really value that opportunity too.
The 21st Century Joined Up Care programme is changing the way care is provided to North Derbyshire's 380,000 citizens. The 8 organisations involved are finding smarter and new ways of working together to improve services and use public money in the best possible way.